Hi, my name is Dr. Tania Crussiah. I am a family physician at Williamsport Family Practice in Williamsport, Maryland. I'd like to talk to you today about the importance of having a family doctor. A primary care physician is a doctor who looks at you as a whole person, not just your heart, not just your lungs, but takes into account your whole body and also how the dynamics are within your family. I actually wanted to be a pediatrician most of high school and medical school. It came to my family medicine rotation in medical school that turned me on to the aspects of family, taking care of young and old, men and women, having variety within the day, and caring for the family unit. There is a lot of interactions there that we have an advantage of observing and being a part of. So when new patients do come my way, I generally ask them how they've heard about us. Typically they moved to the area and looked us up on a phone book or website, and the biggest is word of mouth. So not Google searches or online searches or the paper, but word of mouth of a person who met a good doctor, was happy with it, and referred them out. It is a good idea to actually establish care with a doctor when you move to an area, so that when there isn't a sick or an acute need for a same-day visit, it's easier to enter and see a doctor rather than call around and find who's accepting new patients. And the better we know you before any illnesses may happen is good. One, to help prevent them, and two, when you come in for an acute visit, we can get right into the acute visit rather than the background. We are kind of your mainstay, similar to like a dentist that you always need on board. Typically people find us when they're attending college, when they have their first job and health insurance, when they move to an area. Those are the goals to look at. A good family physician is one that has finished medical school and residency and is board certified. Location's important, ease of appointments and making appointments, the patient's or the physician's personality and how they interacted, the staff as a whole, from their entrance to their exit, how they feel that they're taken care of and that their health matters. Here as primary care we do general medicine, so of course we do services for diabetes, cholesterol, high blood pressure. We do minor procedures such as skin tag removals, shave and punch biopsies. We offer cryotherapy for warts. Some of our providers even do joint injections. And of course we do a lot of in-house testing like EKG, preoperative consultations, sports physicals, work physicals, vaccinations. One of the roles as a family physician is the preventative visit, not when you're sick or coming in for a blood pressure check, but going over your general health and doing screening questions and tests. Cervical cancer screening, breast cancer screening, colon cancer screening, and do the appropriate testing. Most insurances cover a physical annually, and that would be the ideal time to talk about those preventative and screening tests. There is a website that patients can log into that lists all the primary care doctors with their phone numbers. The patient can call around and find out availability. As far as our clinic, we are accepting patients. It may not be immediate, but usually within 2 weeks we are allowing new patient visits.
You're watching Your Health Matters, brought to you by Meritus Health. We'll be right back.